Welcome back. This is Talking Points with Keith Vaz on Leica Radio 1458. Let's go to Sydney, Australia and talk to Dr. Jaimini Raniga, who qualified at St Mary's Hospital in London and has been a medical practitioner of family and integrated medicine for the last 35 years. Having worked in London at the Hale Clinic and in South Africa, she established the Savannah Health Centre in Castle Hill, Sydney, Australia in 2014. Her passion lies in the prevention and reversal of illnesses. She joins me this morning from Sydney. I should really say this evening, because of course it's evening there. Hello, Dr. Raniga.
Good evening, Keith. Pleased to be on your show.
Jaimini, you have a wealth of experience in dealing with alternative medicine. Have you seen an uptake in these services in recent years?
Yes, Keith, I certainly have. I think it's always been an option for a lot of people for many years, but in the last decade, I've certainly seen a growth in its popularity, and I would say it kind of stems from the dissatisfaction that they're getting from mainstream medicine dealing particularly with chronic health issues. And I think that really comes from that we've all very much into numbers and statistics in mainstream, and we're losing that human touch and the listening ability, which I think alternative medicine give you that focus. And often a lot of mainstream medicine is largely determined by shorter consultations. You spend about 10 to 15 minutes per patient. You can't really get to the crux of the problem. While alternative medicine, we spend a good hour trying to do a comprehensive evaluation. It's far more patient-centered and personalized. So I think that in itself has driven people to look for other alternatives besides trying to find an option that creates less harm.
Mindfulness and well-being, what exactly is it? Do you think that mainstream medicine has failed?
Well, let's start with mindfulness. According to some Microsoft Canadian report, the human attention span is actually below that of a goldfish. So one would say it's about 8 seconds as opposed to 9 seconds in a goldfish. So generally a human mind in the 21st century is very much a wandering mind, and a wandering mind is a pretty unhappy mind. And it comes at a fairly high emotional cost. So because thoughts are usually in the past or the future and really nothing to do with the current moment. So, and when they're in the past or the future, there's obviously a negative connotation because you're always worrying about something in the future or you're regretting something of the past. So it's kind of filled with a lot more fear and anxiety. So mindfulness is kind of an attention training, or a meditation is another word that's used. But the outcome of that is that you get better concentration. A concentrated mind will bring better performance and is a lot more attentive. You're more engaged and involved in the activity. So you have a formal practice where you try and empty your mind of any thoughts, and you're just there in the void and the emptiness, focusing and training your mind to be a lot more attentive and more inward. An informal practice that you could be in part of an activity, and while you're engaged in an activity, you're just in that activity rather than thinking of what do I have to do next, or worrying about what Joe Blogg has just said to me a few moments ago. So you're trying to be in the present moment. So that's kind of that mindfulness state. And when you're in that state, you experience more positive emotions like joy or compassion, or you're enjoying the activity that you're doing, and you're far more fulfilled. So it's a regular practice that gets you into that state. And as a result of that, you have a better health outcome. Your mood is better. You get more life satisfaction. Even your immune system is regulated better. So there's lots of benefits with mindfulness practices, but it has to come with an attitude of acceptance, of learning self-compassion, self-love, and it's awakening and a greater awareness develops.
Jaimini, how has the lockdown been handled in Australia? Why have you had so few cases?
I think it's been handled extremely well, and we've been very fortunate because Australia's just had been through a catastrophic bushfire, so they acted very quickly and were already on high alert. So the government came in and the health sector came in and closed our borders very quickly, particularly to the epicenter first, and then other countries that also had high rates. They also imposed strict quarantine restrictions of about 14 days in hotels. They weren't taken there by public transport, but special transport from from the airport to the hotels, quarantine centres. That helped quite a lot of the community transmission from overseas travel. There's also a high rate of testing in Australia, which is extremely efficient, and contact tracing that takes place. And I think also other environmental factors. We were basically going through a warmer climate at that point and hadn't gone through our influenza season. So we're still heading into our winter, so it'll be interesting to see how we manage that. But Australians generally have been very compliant with social distancing and hand sanitisation and wearing, protective gear and keeping their distance. So I think all of that has played a huge role in assisting us keeping our numbers down.
Jaimini Raniga, thank you so much for joining us on Leica Radio 1458 this morning from Sydney, Australia.
Thank you so much, Keith. Thank you for inviting me on your show.